If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. It's free. There's creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place.
You are listening to Africa Business Radio, where you get up-to-date insight on Africa business landscape. Log on to www.africabusinessradio.com. Your favorite shows are available as podcasts. Download them on our website and mobile app. Africa Business Radio, towards a profitable Africa.
We are the wind in the sails of your business. We are your compass. Chart your course towards your targets. Africa Business Radio, toward a profitable Africa.
They are 1.8 billion globally. They will make 75% of workforce by 2025. They will outspace earnings of baby boomers in less than 10 years. Smartphones and tablets are the argument settlers and fact checkers for every conversation. Get more insights on African Millennials on Africa Business Radio, towards a profitable Africa.
Wow, what a Wednesday. I mean, we started January 1st, and who would have thought that the conversations we'll be having on media, on the news, and on social media will be about what's been going on about the virus and whatnot. Well, it's a beautiful Wednesday, I believe, and I just hope everybody's fine. You're doing good. No panic. Just pay attention to the instructions that you see, especially from the World Health Organization. It's Tommy Wale, and it's the African Millennial Radio Show on Africa Business Radio. I have a very, very interesting person who has been shaking up Twitter for a couple of years right now, Aproko Doctor. Man, thanks a lot for coming to the show today. Right. And of course, what we're going to be talking about is about health, really. So I understand you might have thought, okay, let's have another conversation on. Now, we're going to first of all really talk about the health of millennials generally. Everybody wants to get that bag, everybody wants to get that cheddar, but then you need to keep yourself fine, at least get some things done. So I'm not going to talk about these things, he's going to talk about it. But before we go on, let me tell you about him a little bit, right? Egemba, is that how you pronounce it? All right, Egemba Chinonso, that's his real name, right? So sometimes you just go Nonso, right? Aproko Doctor. So Egemba Chinonso is the founder of AprokoDoctor.com. You should check that out. That's APROKO Doctor.com. Doctor fully spelled out. A healthcare focused information outlet dedicated to dispersing health in an easy to learn manner so that optimal health is achieved by everyone. Right, starting from the grassroots by changing habits and influencing decisions, which was birthed out of a need to prevent disease and improve the healthcare outcomes in Africa. And he's starting that with Nigeria. Right, he has won awards in recognition of his efforts in public health education of the average Nigerian. And these are the conversations that we're going to have conversation around things like this on the show this afternoon, and especially how other African countries also can take note of basic things like this. Nonso, which one would you go with? Aproko Doctor or Nonso?
Nonso.
Just Nonso.
Nonso is fine.
All right, cool. All right, so I always use myself as a case study, right? So we just flow from there. I think it was 2017 or so. I had a Samsung phone at the time. So I was just playing with that health thing at the back, that, yeah, and I just checked, and my heart rate was 115. And I checked, I wasn't supposed to be doing over 80.
Okay.
I was not working out. I was lying down, resting, right? And that was scary. So I read about the conditions and everything, heard stories about, people who they had to put to bed rest and things like that. So that got me questioning, okay, tell me, what exactly are you chasing? Like, can you calm down? And I think that could be a whole lot of things happening with people who are trying to get things done, with themselves, looking at this environment also. So looking at me as a case study, looking at the context of the environment we are in, right? What are the things, or what things do you think African millennials, especially the people who are trying to get things done, everybody, Ghana, South Africa, Kenya, everybody, what things do you think they should actually take note of when it comes to their health right now?
Okay, so the most important thing that African millennials need to do is you need to chill out. That's like the first step. African millennials need to understand the concept of rest, especially the concept of sleep. I would give you a personal story. Okay. I was working in a teaching hospital about 3-4 years ago. Ward full of women who were pregnant at different stages of labor. I was working 2-3 jobs at that point in time in 3 different hospitals, and for some reason when I got to the teaching hospital, I had this really bad headache. And I checked my blood pressure. For some, I just felt, why don't you just check your blood pressure? I get headaches from time to time, and I work it off. And when I checked my blood pressure, it was about 180/120. It was really crazy. Any higher, I may have thrown a stroke. It was that bad. And I got to realize that before then, I had issues concerning high blood pressure. But, I didn't take note of it. So I just, was just working. And who would have thought that a doctor, who is actually supposed to be the epitome of health in the society, could have a stroke or would have, thorn a vessel in his brain or something.
Exactly.
So,
that's you being a medical doctor.
That's me being a medical doctor. But millennials are always consumed by this need to always do a lot in the shortest time possible. It's almost as if the millennials are impatient, and we need to understand that life happens to everyone, and everyone needs to rest. I also think that the fact that millennials are stressed, it was a mentor of mine that told me that the fact that you think you're stressed could also come from the fact that you are not as, you are not as organized as you should be. And the fact that you're not organized could add to your stress levels. Added to your stress levels adds to your health, as in has health implications, because when you're not organized, you tend to carry stuff from yesterday into today, and you keep carrying the backlog of work, and you think you're working, you think you're grinding, you think you're doing what you're supposed to do.
I'm sleeping at 2 a.m.
Yes,
I've not slept. I only slept 2 hours today.
Yes, you find African millennials carry that sort of statement with some kind of pride. When I grind, I sleep like 2 hours every day. And then you now have the motivational speakers who come up and tell you that, sleep is for the dead, sleep is for the weak, sleep is for people who don't have goals in their lives. And some even quotes the Holy Book and tell you that a little sleep, a little slumber, and poverty will come upon you. So there are things that we need to understand, especially at this point in time. And one of the most important things is rest. African millennials, wherever you are, I know you're grinding, but sometimes you just need to chill out.
So you mentioned something. I just replied your tweet now and told people to join in africanbusinessradio.com. I don't know if that can happen. So we can have maybe people tweet things and ask questions about this also and just read it out. So the concept about not being organized, right? I think I want to take it to, do you think it has to do with the demands of our time right now? Do you understand what I'm saying?
Yeah.
So we, maybe the guys before had some basic things that the government provided for them, but then we have to really build in. So I give this example. Would you say this guy is incompetent? So he says he's going to send something to you at 12 a.m., right? He wiggles through traffic, thinks, okay, I'll get home maybe 9 o'clock, right? Settle down, get on the work by 10 p.m., do the 2 hours and then send it by 12 a.m. and I'll go to sleep. That's his plan, right? If he's in London, he would do it, he doesn't have to worry about lights. But this dude forgot to buy fuel in the gen. So he starts working at 10 o'clock. And then by 11:15, NEPA takes lights. So would you say he's incompetent? I'm coming. Just hold that thought. So now when it comes to maybe millennials trying to double up on things, do you think it has to do with some of the amenities, or there can still be a way that they can plan themselves around just trying to meet some demands?
Okay, it's more of a double-edged sword,
right?
Because on one hand, it could still boil down to a lack of organization.
Okay.
On the second hand, it would also boil down to not having the right amenities.
Right.
For example, it takes me sometimes a little longer than it should to upload a YouTube video. Meanwhile, my counterparts who are in countries like the UK and Canada and the US just click upload, and in less than a minute or two the video is online. But it takes me time. Sometimes it doesn't even go, and you have to keep pressing the upload button over and over again. Now that could also happen, but there's also planning around those events, like those inadequacies that we tend to have. For example, this guy, if he had sat down and listed out the things he needs in order to get this project sent by 12 a.m., one of the things that should be in his list is fuel. And so he should make a list that, by on my way back from work, stop by the filling station and get fuel. So like I said, you would not say he's incompetent, but if he had planned better, he probably would have sent it by 12.
Okay, angle. All right then. Okay, that's another. Now, moving on, right? So we understand that we need to rest. We need to, take good care of ourselves. There's this thing about, I was asking basic questions, right? So there's this thing about lime in water, right? What's it called? Don't drink too much of soda, drink water a lot, right? Take fruits and everything like that. Is there any side effect of things like that? Because this is me now. This is me layman now. Someone's like, don't worry, take Coke once in a while, for example. Right? So it's not just going to be water. I'll just drink it, have the sugar and everything. I'm like, no, I don't even drink soda so much, right? Lime in water. Some people say things like it might reduce some maybe sperm count or things like that. Please, can you just maybe demystify so many of these things? Because I think the in thing now in offices is just this lady who walks. Sorry, I'm talking a lot. I'm not supposed. There's this joke that says in every office there's one guy who is really doing the work, someone who posts on Snapchat, and then one who carries water with lime around.
Yeah, sure.
So can you maybe
just talk about it? Yeah. So millennials tend to take a lot of health fads, hook, line, and sinker, without looking at the health implications, or rather looking at the real research from things like that. For example, most people who do that tend to assume that taking lime and putting lemon in water will tend to make you lose weight. And when you ask them, okay, so where did you read it from? It was probably from one blog post or one fitness enthusiast, someone on YouTube or someone on Facebook that, listed it and says with all confidence that, oh, I did it and I lost so amount of weight. What they don't tell you is that when it comes to, losing weight and being healthy, you need to reduce the amount of calories you take in. Now, when you compare the kind of food we eat now compared to what the baby boomers ate, you can't compare it, because the kind of food we eat now tends to have more calories than what they ate then. Now, the kind of food we eat now tends to have less vegetables, less fruits, and compared to what they ate then.
So because more processed now, right?
Yes, because it's more processed. So we eat a lot of more processed foods right now. And for crying out loud, most people work from 8 to 8 and then get home when it's almost midnight, and such a person can't cook.
Yeah.
And so they rely a lot on
fast food.
On fast food, burgers, shawarmas, and everybody's eating it and everybody's adding weight. Some research even shows that millennials tend to have a higher increase, or rather tend to be more obese than the earlier generation, especially when they turn 27.
Oh, wow.
So
the guys that are below 27, you guys are still, they are coming.
So
you're coming for it.
So you see this guy who is 24, 25, looking all trim, looking all fit and all that, and gets a steady job, becomes stressed for a while, and you see him 5 years later and you're wondering, boy, what's up? Why are you looking so blown up and all that? So there is a lot of fads around people who want to lose weight so quickly. Lemon in water would not make you lose weight. That let's just get that out there.
So what does lemon in water now do? Because there's just that it's so fashionable. They're even bottles with it.
It makes the water taste better. So it makes you drink water more.
So
for
that's
some people, that's just it. It would not make you lose weight. I once had someone who had so if a person has stomach ulcer, for instance, things like lemon, oranges contain citric acid that could worsen the ulcer. So I once had a patient who took lemon in boiled water and added coffee to it.
Why?
She wanted to lose weight and drank it and spent the next...
What kind of taste is that though?
And spent the next 1 week in the hospital treating the ulcer because it got really worse. So if you have ulcers, stomach ulcers, you should avoid lemon in water.
Wow. Okay, so it's about the work-life balance. It's you trying to get some rest. It's us demystifying. It's Nonso, Dr. Nonso, demystifying this thing about lemon and water. So actually you just doing the exercises, right, and eating less of the processed foods, and then you'll be fine. Because I don't really think about it. So we're doing all this grind, we're working and everything. We want to enjoy this money in our 50s and 60s, right? Would we now be spending most of the money on what's it called?
Hospital bills.
On hospital bills. Do you get what I'm saying? Rather than actually enjoying the life. All right, guys, let's have a short break right now. Then we'll be back to talk about a couple more things as regards cleanliness, and then just dot on the virus thing happening lately. All right, then see you in a bit.
Please listen to this public service announcement on preventive measures against the spread of coronavirus.
All Nigerians should take care of their health and maintain hand and respiratory hygiene to protect themselves and others, including their own families, following the precautions. 1. Regular and thorough washing of hands with soap and water and use of alcohol-based hand sanitizer. 2. Maintain at least 1.5 meter 5 feet distance between yourself and anyone who is coughing or sneezing. 3. Persons with persistent cough or sneezing should stay home or keep a social distance, nor mix up with crowd. 4. Make sure you and people around you follow good respiratory hygiene, meaning cover your mouth and nose with a tissue or cough into your sleeve at the bent elbow or tissue when you cough or sneeze. Then, dispose of the used tissue immediately. 5. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing. Do not engage in self-medication. Please call the Nigerian Center for Disease Control and CDC toll-free line, which is available 24/7 for guidance. 0800 970 000.
This message is powered by Africa Business Radio.
Yeah, welcome back, guys. And if you're on Twitter, it's @proco_doctor. Is that it?
Yeah.
On Twitter, I think you should follow him. You should follow him a whole lot, because, in fact, follow him and go back and read some of the tweets. You were telling me one time that there was someone who was choking somewhere in Nigeria, and then what they did was they went to pull up your tweets.
Yeah, so 2 cases actually. There was one who was choking,
Wow.
and then there was one who had a seizure. But the one that caught my attention was the one who had a seizure, and he was standing beside someone who suddenly just started convulsing and did not have an idea what to do. Then he remembered that I had tweeted something about it and ran to my Twitter page and searched it and came up and did exactly what I had written in that thread do step by step, and they got the guy to the hospital and the guy was saved.
Can you imagine? I mean, you're doing a whole lot, man. You're doing a whole lot for the medical space, and I mean, that's why I keep saying that. Thank you for coming, because you should get what's that award they give them? GCON. You should get that thing, really, because what you're doing is way beyond, what anybody would have bargained for when it comes to free healthcare in Nigeria right now, or in Africa right now. Well done. So @proco_doctor, right? Now there's this thing I saw recently. So they asked, notice, what's your toxic trait, or what's your trait? They say ghosting, right? So someone said, are you sure the person is ghosting you, or the person is just practicing social distancing? Right. So it's about cleanliness, really, right? Your environment, the hands, and things like that. And now, for some reason, it looks like because... Okay, let me take it back. AIDS was in town and everything, so people started practicing abstinence. And then now, this dude tweeted one day and said, I think then the rate of the virus was about 60,000 people. So he said just 60,000 people have this thing global, everybody's shaking. I mean, over 30 million people have AIDS, and people still don't use protection. Anyway. So what's the panic, about? Is it a psychological thing, or people should actually panic, or is it a call to cleanliness? What do you think of any of this?
Okay, so I think it's a little of both.
Okay.
The first is it's a new virus. Right. Nobody knows about it. I keep telling people that sometimes it's not just the infection that you should be worried about, it's the aftermath. So sometimes some infections may have complications later.
Oh God.
For example, syphilis.
Okay.
There are certain cases of untreated syphilis, especially when it's not treated properly, that could lead to some brain function being affected.
So syphilis, where does that come from again?
It's a sexual transmitted disease.
So, are you guys hearing? All right, cool.
So it's a new virus. Nobody knows about it.
Sorry, my producer's face is funny. sorry about that.
I think we have his attention now.
Yeah, I think so.
So when it comes to the novel coronavirus, it's yes, there should be some level of caution. I don't want to use the word panic, but caution at this point in time. Okay. So cleanliness is actually a must. Over 80% of diseases are spread from the hands, and if we can actually wash our hands and ensure that we're socially distant, not emotionally distant this time, but socially distant.
As I've had emotion.
So if we're socially distanced, we could at least halt the spread of the disease from one person to the other.
So there was this video that Van Nistelrooy posted on Instagram. So it was matchsticks, and then the lights started coming, and then one decided to step back out of it, so he stopped the fire from spreading. So I think that's the guy with the clean hands.
Yes, but I tried that video in real life. It doesn't work. It burns everything.
So that was animation.
Yeah. So social distancing basically just means like maintaining the distance of 6 feet from one person to the other person. So especially in areas where you have a lot of these outbreaks currently, so it's advised that you keep a distance of 6 feet from, as in between you and the next person. That's based on the research that says that when you cough or sneeze,
Okay.
the droplets usually go about 3 feet.
3 feet.
Yes.
Okay, so I was in a cab this morning, and then the driver sneezed, but he sneezed the other way.
Was it enclosed?
Yeah, of course it was AC.
So
I wound down after though.
Okay.
Like I said, I'm sorry, and I wound down. Why is Mickey stepping back? Right.
So usually in enclosed spaces, the chances of infection the chances of a person getting it is more.
Okay, because it just circulates.
Yeah, because it just circulates.
So I wound down immediately. Though.
Yeah. So, and I even found another research saying that it could suspend in the air. The droplets, like I said, we still don't know a lot about this virus. We're still learning about the modes of transmission. It could even stay on surfaces for up to days. And at this point,
there was this video I saw. It was a primary school where the teacher told the girl to put her finger in like a bowl of germs or things like that. She did it. And then she now told her to just put that same finger in soap. And now bring it back, and then everything went back. I mean, that just explains and re-emphasizes the point of just washing our hands.
Yes.
Is it Ariel or one of these brands, detergents, something that did a campaign last year about washing hands, right? People didn't pay attention to it. It was on Twitter where they got, I think maybe it was going to be the longest washing hands thing, Guinness Book of Record. And they were like,
I think I saw that.
You saw that?
People don't pay attention to things as long as it doesn't. They don't see a need for it.
Something breaks out.
Yeah.
So you're sitting down on a table. It's a long table of about 20 people from different aspects of government, right? And then you are the consultant that would give some suggestions on measures that government should take for this period. What are the things you say?
So one of the first things I'll say is to equip the doctors, the healthcare professionals or rather equip them in a way to help them adequately fight this virus. That's the first. Number 2, restrict inflow into your country.
Absolutely.
It's been shown that a lot of these infections have come from people who are coming into the country, and it's most likely through the air travel. And we need to do this like yesterday.
Right.
Restrict.
How they restricted, and it was going to start March 31st. That's next week.
We need to have done it like yesterday. Ghana restricted theirs. If your country has more than 200 cases, restrict.
I think South Africa did that also. I saw a video.
So we can't still. Yes, there are economic implications of restricting flights into your country.
But then health.
But then at the same time, we still do not have, and I'm speaking from a candid point of view, we still do not have the health facilities to contain an outbreak if it happens. Lagos is one of the most congested, dense populated areas in the world. Currently, in this small kilometer square of space, you have 21 million people with crowded buses, crowded bus stops, crowded markets, and all you need is just one person to sneeze or cough in a crowded place, and
no more bless yous for coughs now.
No more. Every stare, most people don't even stare. They just slide back like Michael Jackson. And
this is a video. It was like Corey was trying to cough during the press conference, so he held it back. He held that cough, man, before he just weeks the dude and say, "Brother, what's going on with you?" Right. I mean, I've been enjoying this conversation with you for the past 30 minutes right now. And at the end of the day, I look at some like, okay, all the work that boys are doing, that ladies are doing, breaking the glass ceiling, you're there right now, your heels are popping, everything is going well. And then you're not taking good care of yourself, right? Even before something happens that makes you want to go to the hospital, are you yourself doing the job of taking care of yourself? Are you taking health personal? No, I don't mean self-medication. but then are you just conscious, right, of yourself? And I think that you've been able to address, first of all, the point of rest, right? Yoruba has one that it says kirakita or dollar. It means jumping around is not what brings in the dough or brings in the bag, right? But then you've addressed that. It's not pride for you to sleep for 2 hours. Guys, sleep. Right? Sleep 6 hours. Right? That's what you say. 8.
Actually, 8.
Okay. 8. They said 8 too. If you like, go late. Well, 8. So 8 hours. Just to reduce the processed foods and things like that.
Exercise,
right?
also.
Exercise also. And then the governments, please, we're in a very, very interesting time. The next generation of things is really going to be at stake based on your decisions. Help us, right? Put things in measure. Stop people from coming into the country for now. We'll do Skype and video calls. We need to talk to people. Right. Thank you very much, Aproko Doctor. Guys, don't forget to go on Twitter, Aproko_Doctor. Right. Follow him, enjoy his conversations, laugh at his jokes, learn from his lessons, and then get your space healthy. And don't forget to go on getuping.com to take the survey on African Millennials. All right, guys, it's Tommy Wale on the African Millennial Radio Show. And I'm going to say bye for now.
Cool on the beat.